Good morning, everyone. This is Julie Ring from the Association of Minnesota Counties, welcoming you to our MnCHOICES Overview for county officials this morning. This presentation is being coordinated by the Association of Minnesota Counties and DHS, and we know there's a lot of interest because as of yesterday, I think we had 230 registrants for the program. I'm just going to do a little technical housekeeping before I turn it over to our presenters. Today, during this presentation, what you'll see in front of you is our PowerPoint. That's the only thing that you'll be seeing. We did not send out any documents ahead of time. I apologize for that. We're learning as we go. But the PowerPoint will be available on our website after the webinar, as well as any other documents that we referenced during the webinar. In addition, we are recording this webinar and we'll be posting that on our web so that you can share it with others in your organization if you would like at a later date. During the webinar, if you have any questions for the presenters, please use the question function in your webinar. I will be monitoring those throughout the presentation today and sharing them with the presenters, and we will answer as many as we can. We also will be keeping track of all questions, so if we don't get to your question today, we will be compiling them and putting together a FAQ type document that we will post on the web as soon as we can, along with all these other pieces of information for you. And so with that, I'm going to turn it over to our first group of presenters, Pam Urkel from DHS and Megan Mose from Ramsey County.
Good morning, everybody. This is Megan Mose from Ramsey County, and I want to welcome you to our webinar today. I wanted to kick this off today by really welcoming you all to our meeting. This last Friday of the month for the last 3 years, really, has been a gathering time for county and state representatives, many of whom are here in the rooms in St. Paul today to present to you. We've been working in partnership on this project, MnCHOICES, and the related reform efforts that go along with MnCHOICES as a group for 3 years. So we wanted to just really show and demonstrate to you today the partnership that has gone on over the course of that time. And by doing that, we're going to be presenting as a team today some information about MnCHOICES. Oh, it needs to go.
My name is Pam Urkel. Thank you, Megan. And my name is Pam Urkel, and I'm with the Department of Human Services and Disability Services Division, and I've been the owner of this project, if you will, since its inception. We received funding for MnCHOICES in the 2009 legislature. And so we're going to be talking to you today about what is this and where are we at with it. MnCHOICES is an initiative that will establish a uniform comprehensive assessment process for determining eligibility for our long-term care services, including home and community-based waivers. It also helps us in defining the components of what's an administrative function versus what is a service, such as case management. We'll be implementing a new process, standards, and web-based software application to determine a person's eligibility for home and community-based services and other long-term services and supports such as personal care assistance services, private duty nursing. We'll be requiring lead agencies, counties, tribes, and health plans to act certified assessors and conduct the assessments that determine eligibility for programs and services. And as I talked about, we'll be identifying administrative functions of eligibility determination and service eligibility, and it'll be requiring a uniform assessment process to determine the eligibility for long-term services.
So we'll be providing more detail about the items that Pam just overviewed for us in this first part of the presentation called the basics. And the second part will go into more detail, and really it's intended for different audiences, but you're welcome to stay with us through the entire presentation if you wish. So obviously this is Megan again. I'm going to talk a little bit about what the purpose of the webinar is today. Obviously we're going to be sharing, as the title would indicate, we're going to be sharing information about MnCHOICES. And we really wanted to make sure, as I referenced earlier, that we had both county perspectives and DHS perspectives at the table. You know, as I said, we have been in partnership on this project, but there are sometimes differing perspectives, and through the work of this group we've been able to talk through some of that and hopefully get to the point in the project where the best product is going to be moving forward. And really overall our goal is to inform county officials on the status of the MnCHOICES project. Let's face it, folks, this is a very complicated effort that's had lots of different moving parts. And we know, especially for smaller county staff, for folks who haven't been as directly involved as some of us in the room have been, it can be hard to look in from the outside and really understand the details of what's going on. So hopefully you'll walk away from the webinar today with some of that information. A lot is known at this time. A lot still has to be decided, so you won't walk away from the webinar today with absolute answers about everything, but hopefully you'll have more a sense of where we're headed. And I think a key aspect of what we're hoping to accomplish today is really talk about thanks, Charity. Got your comment. I'll try to talk louder, sorry. One of the key pieces we're hoping county folks will walk away from the presentation with today is, you know, as the administrative arm of the state and knowing that this product is going to be rolling out this year, what are the things you need to be thinking about for implementation at the county level? DHS will speak to that, and then we'll also provide some information in terms of, at the county level, what you need to be thinking about to implement MnCHOICES in the best way.
So what's our vision for our long-term service and support system? Minnesota has been a leader over the years in bringing people out of institutions and promoting home and community-based services for people of all ages and disabilities to remain in their home and be contributing members to their community. So we really want to support people in having that meaningful life. We want to be flexible and responsive, and have the service system be accessible to all people who need the services. In the beginning of our long-term service and support system, we spent millions of dollars, which is a lot of money, but currently, just to put that in perspective, over the past 30 years, we've increased that expenditure to now spending over $3 billion on home and community-based services. And we want to ensure that the system's sustainability in order to keep those services available to those who need it in the future. And that's really one of the driving forces of our transformational initiatives such as MnCHOICES and a couple of the other projects we'll be talking about a little bit later. And the context for the change is really about the demographics. I think everybody has heard, and everybody knows, if you're in, especially if you're in this business, that the demographics are changing. We have baby boomers coming, we have economic pressures, you know that we've had budget deficits over the last several years. But this long-term service and support system is at risk then of not being sustainable due to some of these very dramatic changes. We also have some opportunities to support innovation and reform. We have technology that has come a long, long way. We have a very paper-based system right now, and what we're looking at with MnCHOICES is really a software application, using laptops, being able to create data that we'll all have access to. So there's a lot of technology changes that have occurred that will really help us in keeping our system sustainable. We also want to comply, of course, with the federal requirements. Of that $3 billion that we spend on home and community-based services, half of that comes from the federal government. And as home and community-based services have grown, so has the look from the CMS, the Centers for Medicare Services, Medicare and Medicaid Services, and so has their expectation of helping them understand how we're spending the money that they're giving us. So it's really talking about how do we make our system sustainable and comply with the federal requirements. And in order to do that, ever since we've started with home and community-based services, we have a strong county-state partnership. Counties have been our right arm, if you will, in administering these programs and making sure that people at the local level have the supports that they need. And we need to continue that strong county-state partnership in order for MnCHOICES and all of our other transformational initiatives to continue.
And this is Megan. I just have to jump in on this slide a little bit too and mention for county folks who may be listening that aren't involved in this particular work day-to-day, long-term care consultations, etc. Our staff are out there using a paper and pen form still in 2013. They bring it back to the office and we do manual data entry into MMIS. If for no other reason than technological innovation and efficiency, it's really time to move forward. But the reason moving us forward isn't necessarily the technology. It's really the philosophical change that we're going to be talking about, which initially I think in part was informed by a push from the federal government. But as we participated in this process more and more, we've really bought into the philosophy change and have become supporters of what we're trying to do from a philosophical standpoint. And I'll hand it back to Pam for the next slide.
So what's the objective then? Our current system, and as I said, has all the different programs and policies and services have grown up over a matter of decades. And with each different program, there have been different policies, different ways to administer it. And we've given it to the counties, to all of you, to help us do that. And quite frankly, with maybe not as much information or tools that you probably needed. So we all have some work to do in terms of the tools that we need to provide you. In addition to that, what happens is that we kind of look at services and supports in terms of the programs that a person might qualify for. And so if somebody's coming to your door and needing to have maybe look at personal care assistance services, then you would get an assessment for personal care assistance services. So we're really trying to move away from what programs does a person qualify for and really go into what does that person really need to meet their goals to stay in the community. So that's really the change that we're trying to come to at this point with MnCHOICES. Do you have anything to add?
And sorry, Pam, yep, I have to jump in here too.
Sorry.
This is really from an implementer and operational standpoint. This is a key piece for us at the county level. We presented to the Ramsey County Board of Commissioners a few days ago on this issue, and one of our commissioners made the point that we need to stop asking our customers who come to us for service to jump into a silo right away. We need to stop asking them to use certain buzzwords to get certain things from us. We need to approach them from a more of a person-centered standpoint, look at their needs holistically, and also, find ways to help them use informal supports whenever possible and not always be putting them into government programs. And our current system is more set up to track people into programs rather than looking much more holistically at them. So this is another benefit of the direction we're moving in.
And MnCHOICES software application and the assessment process, the content, really moves us in that direction. So what won't change? Well, what won't change is our mission and values of DHS and the Continuing Care Administration. And we've talked about it in terms of what MnCHOICES is, but our mission at the Continuing Care Administration is really to improve the dignity, health, and independence of the people that we serve. And again, we can't do that in isolation. At the department, we need the assistance of our partners at the county and local levels to help us really achieve that mission. We want our values are equity across individuals, lead agencies, and providers. And in a way, the way the system looks right now, there are many different ways to access services, to get, depending on where you might be within the state. And we really want to have some equitability across individuals, lead agencies, and providers. We want to increase the quality of services, and we're being asked to measure, we're being asked by CMS, the federal government, to measure in a different way and prove to them in a different way that we are efficiently and effectively using the money that they're giving us. There needs to be transparency, efficiency, and consistency. We need to understand, everybody needs to be able to see how people are being assessed, how people are accessing the systems, and how they're using the public funds. And we need to continuously improve the service administration. If we measure what we need to measure and have an understanding of what's happening from those measurements, we can improve the quality of the service system.
Don't worry about that. I'll worry about that.
Along with MnCHOICES, there are a couple other reform projects that have been happening since 2009, and these particular projects are also transformational in nature. But a couple of them, the provider standards and the rate setting system, were are an example of needing to move in a different direction based on some feedback from the federal government and how we're managing these programs. Currently, the providers for all the counties, and the counties set the rates for the services, and they also contract with all the providers to provide the services within their local area. From the federal perspective, that can leave people having inconsistent access to services, and it can also lead to having some issues with being able to, for all providers who are qualified to enroll. So some of these changes are actually being driven by at the federal level, and so the two major initiatives that join with MnCHOICES is the Provider Enrollment and Provider Standards. It's the Waiver Provider Enrollment and Provider Standards Initiative. And so this will create a statewide mechanism for enrolling providers and enhancing the provider standards. They're going to be developing consistent and equitable waiver service and standards and improved processes to verify provider compliance. And this is all done right now at the local level. We'll be enhancing provider standards to improve the delivery of services. It's increasing the recipient access to a choice of qualified providers. And lead agencies will no longer be contracting with providers. The contract will be replaced with statewide provider agreement. And we'll be developing statewide methods for lead agencies to monitor providers. So there will be a very significant role for counties in this particular initiative as well. And we'll be integrating existing provider quality assurance and oversight mechanisms. The second initiative is the disability rate setting methodology. Again, as counties currently contract with providers, they also set rates for individual services at that local level. And this rate setting methodology initiative will be establishing a statewide rate setting methodology for all the home and community-based waiver services for individuals with disabilities. We'll be identifying the components of each waiver service, determining standardizing pricing for each service component, and creating rate methodologies based on the service components and individual needs. So those are the three major initiatives, but we have many, many initiatives that we're continuing to work on at the department as well.
This is Julie Ring again. I want to just jump in with a couple of questions and some feedback. Thanks to those of you out on the webinar who are keeping us informed about the sound quality. We are making some adjustments to try and account for that. But if you are having trouble hearing, please feel free to let us know that. We'll continue to tweak it. For our presenters, do your best to project. And we did get one question in during this last piece that I'd like to direct to the group from Chisago County asking why is the program not being implemented consistent with the county budget cycle on a calendar year so that the costs could be more reasonably budgeted for and planned for at the county level. So can you say a little bit more about why this timeline is chosen and how you see that interacting? So a little bit of the question for DHS, and it's possible that also our county folks might want to say how they've been managing that from their perspective.
That's a very good question, and we've been in the process of developing the MnCHOICES software application since 2009, as I said before, and some of this is dependent on the process by which that development is occurring. We have been working with a group of counties and health plans and tribes, and we call that group the first implementers. And that group was identified early on in this initiative to help us while we were proceeding with the development of MnCHOICES. Every time we send the application out to test it, then we get all this information back, and then the programmers and the business analysts that we have with us have to make changes to the application. Those changes and how long those changes take are really based on the information that we get back from you. And so some of the timeline pieces are really dependent on how quickly the application can be changed and sent back out to do the final testing. And currently, we just finished our Beta 2 testing, which you'll hear about a little later. But we have based our timelines based on when we think that the application will be ready for implementation.
This is Megan from Ramsey County again. I really want to agree with the questioner's question. I think it's a very legitimate issue to raise. It's more difficult to implement things at the county level midstream in a budget year. I guess what I've seen from my perspective is I believe as county representatives on this group, we've consistently given the state staff the message that we do not want them to implement this until it's ready. We've had previous learning experiences, I'll call them, with software packages that were not quite ready for prime time when they were implemented. And we've been very clear with the state that we don't want that to happen with MnCHOICES, and actually counties pushing back in some cases have caused some of the delays that have occurred, specifically around the training. We've made some requests around the technology and compatibility, for example, with the SSIS system that have caused further delays in the project. So I think from my perspective, it's been a little bit of balancing between counties pushing on one end, get it right before you implement it, and then, at least from what I've seen, the federal government pushing a little bit on DHS to get this released. And I guess, to balance that all out and have an implementation date fall at just the right time for a county fiscal year, it gets kind of tricky. And the way we've handled it locally in Ramsey, we had a presentation to our board last week with a staffing request around MnCHOICES. So we have handled, MnCHOICES related resource needs just through the normal RBA process outside of our regular budget cycle, and that has worked okay for us. I think other counties are doing the same.
And this is Kay Dickinson. I think Tom and I will cover some of this later on, and I think it's also fair to say that the firm rollout date is continuing to evolve. And so it's probably a premature question about when will this really go statewide, and who knows, it might be closer to an end of a fiscal year than not until everyone's on. And so I'd say just be patient, and I think the state has shown that they're continuing, as Megan said, to really honor the feedback of making sure the tool's ready, and that this is part of our comment today. It's about capacity planning on the county end. And Tom and I will talk about that more.
And Tom Henderson, to the degree that this question has to do with county levy cost and trying to budget ahead for it, you'll see in a presentation later that there's not to be an effect on that, and we'll show you how that's going to happen.
Okay. Should we move to the next slide?
We'll keep moving, but
Okay.
keep your questions coming. Thank you.
Yep, we'll be talking more about the budget, as Tom said later on. We're getting questions about the budget and funding issues. I'm going to move us on to talk a little bit more about what is MnCHOICES from a county perspective. And I have to say, you might find this surprising, but for those who are perhaps politically more on the end of supporting small government, I think this is something that you're actually going to really like. It's really, I think the message that's being delivered with MnCHOICES is that there really is a singular core county role when it comes to home and community-based services, which is conducting assessments. And really all of the other services that are provided under the home and community-based umbrella, they don't need to be provided by the county. And really from a recipient standpoint, they want to have a choice of provider whenever possible. So if they're going to be living in a group home, they're going to be receiving PCA services, they're going to have a home health aide, whatever it is, they want to be able to choose the provider that works best for them. And it really is sort of that free market competition, that operates our whole economy. But what we're seeing through MnCHOICES is, no, this is a role that does need to be played by government. We're distributing, tax dollars for government resources, and we need to be the ones deciding, what the person is eligible for. And also, what goes along with that is we then can come in as the county on an annual basis or more frequently as needed when we do these MnCHOICES assessments and have kind of an objective look at what's going on with that client. Is the quality of services they're receiving consistent with what we want for our people who live in our county? Are the providers doing a good enough job? And I think as government, that's really a role that we want to be in, and we have welcomed it. In any sort of, philosophical white paper type writing that's gone on within LPHA, MAXA, AMC has really outlined that this is and should continue to be a core county function, whereas some of the other things can be sent out of the county to private providers. It's a little bit of a trickier question, when it comes to smaller counties around the case management piece and having choice of case management, but certainly in the larger counties, it's a very clear, in my mind, it's a very clear distinction. So MnCHOICES, in terms of what our workers will be doing, it does combine that assessment piece that I was just talking about, figuring out what the person's needs are, and then secondarily what they might be eligible for and or what informal supports could help them. Our staff that are doing MnCHOICES will also be doing an initial service plan for the person before it's handed off to case management. So as we talked about a minute ago, ultimately we will be determining eligibility for programs and services. And really the nice thing about this form and the MnCHOICES document is it's for all ages and all disability types. So rather than, again, forcing people to go into different silos, oh, we use this form on you and this form on you and this form on you because you fall into the DD bucket or the over 65 bucket or whatever, it's just an acknowledgement that people are more similar than they are different, and actually you really could have very similar support needs, even having very different disabilities. And so the MnCHOICES form really helps us get to that reality. As we talked about earlier, this is a web-based application, so again we're getting away from that paper and pen form, which is, I think, will be a nice transition. And an important piece of it, and I think this is this last bullet here that really came from county feedback that was brought to the table, the acknowledgement that there are dead spots in terms of being able to get an internet connection, both in greater Minnesota, and I can tell you here in the cities, in the central cities, there aren't a lot of cell phone towers and an ability to get a cell signal. And so we were very clear with the state that this is an application that needs to function offline. So basically you upload it before you go out, and you don't need an internet connection when you're out with the person and their loved ones, talking with them about what their needs are. So it gives you a little bit of background about what our workers will actually be doing when they go out and use MnCHOICES. Okay, I'm going to continue on here. This is Megan still from Ramsey County. Oh no, that's right. Yeah, this is right on the right slide. We're just making sure you're getting the right slide here. Pam spoke at the beginning, and I talked a minute ago about how we're replacing, again, these different buckets, these different assessments that currently exist, and just trying to take the same approach with everybody. So here's the 4 that MnCHOICES will be replacing, and actually the 4th one is down the road. So for now it's the DD, screening, LTCC, and PCA. People who formerly used to get those separate assessments now will just be using MnCHOICES with them. We talked about earlier how this is really more of a person-centered approach. And, I do want to just make an editorial comment on this one. I think early on in the process, personally, when I heard DHS talking about, oh, MnCHOICES is going to be more of a person-centered approach, I have to be honest, I think I felt a little bit offended by that comment, because it was sort of like, well, what do you mean? You don't think we're doing person-centered planning now? And I think those thoughts came from a misunderstanding of what DHS meant when they were talking about person-centered. They know that we do person-centered planning right now, and I'll hold up our staff's ability to do that in Ramsey County with the best of them. But really how I understand it now is they're not saying that we're doing it wrong. It's just saying let's start the assessment process with not making assumptions about what people's needs are. Again, by pre-classifying them into groups. Let's take more of, in some ways, a blind eye and not make any assumptions about people when we first meet them. And that truly does allow us to be more focused on that individual person's needs rather than what the name of their disability might be. So just wanted to put that out there. And the bottom bullet here on this slide, There is going to be a change now about who conducts assessments. So in Ramsey County, we have a lot of contracted case managers, and our in-house employees and our contracted case managers all do assessments. Well, that's going to change. All those assessments that are done by contracted case management out in the community are going to be coming back into the county. And I know it's a little different in smaller counties. You might not have contracted case managers. But this is something that can only be done by county staff. And it also requires that those county staff who are going to be doing this are certified. And there is a significantly deep, I guess I'll say, training program that goes along with that for people to get certified. And then another change that I think will, for some of the counties who have a lot of facilities located in them, that could be significant is that the county of location now will be responsible for conducting all assessments, not the county of financial responsibility necessarily anymore. So hopefully that gives you a little bit of a sense of where this is heading. We can move to the next slide. Okay, this talks a little bit more about the partnership between state and counties. And you know, in a lot of cases, I think counties come to meetings with the state asking for clarity around the county role. What do you want us to do? What is our role in this? And I think this slide helps us really talk about that in a clear way. So on the state side here on the left side, these are the tasks that they are responsible for and really that they have been doing in the MnCHOICES project. And the key words there I think are administrative framework. And they really are trying to support that buzzword that I talked about a minute ago, that person-centered services that we want for everybody. So they're establishing expectations for us. I love this next bullet point. Provide a functional assessment application. Yes, we all want the software to work, right, folks? Heads are nodding here in St. Paul. Fair and timely MnCHOICES payment to counties. We're going to talk more about that later in the presentation, but that's a key piece for us. We know it's not all about the money, but if you want us to have the staff out there doing the work, we do have to get paid for what we do, and there is payment for MnCHOICES. Innovative and meaningful training, and then they are going to be, I think, more able to look at data and share data with us about the level of quality that's out there. So then on the other side, in terms of the county role, let's see, we will obviously be the direct service providers. We're the administrative arm of the state, we like to call ourselves. It's handy that there's actually two arms in this slide. Whoever did that, thank you very much. So really the responsibility on our end is to make sure we have the staffing and the technology in place that's going to support MnCHOICES. And again, we'll talk more about how we can do that as counties. And then the data that is able to be provided to us as counties to make sure that not only are we generating data locally to the extent we can, but that we use what the state gives us to refine our approach to working with people. And then really participating in this quality improvement process. And like I was touching on earlier, with just counties doing this role, with the focus on certified assessment, we really are going to be able to focus more on quality. And I think that's what the people who live in our counties deserve and demand, and now we'll be able to do a better job of that with MnCHOICES.
And I would just like to add on this particular slide in terms of the collecting and analyzing the data, one of the things that we really want to do, especially with the software application, is really to be able to look at any of the trends that are occurring in the data and what will help the state and the counties then to improve what we're doing, not only with our assessment process, but also with the services and supports that people need out there. So we will inform the data will be able to inform our policies and our changes that need to occur. So this partnership goes on and continues on even after implementation because of being able to collect and analyze this data in a very different way.
This is Julie Ring from AMC. I'm going to jump in with a couple of questions for our presenters. We've gotten a number of them in. Two that I think directly pertain to the information we just covered. The first is, does the MnCHOICES assessment replace the Rule 185 assessment to determine eligibility for case management for developmental disabilities?
The Rule 185 case management will be included as within the MnCHOICES application. We have that does not necessarily mean that you don't have to get psychological testing and things like that to assure that somebody has, or to determine that somebody has a developmental disability, but a person with a developmental disability will have use MnCHOICES as their assessment process, and then will be referred for determining whether they meet the developmental disability guidelines. But then that information goes back into MnCHOICES, and MnCHOICES will tell you they will tell you if they're eligible for Rule 185 DD case management.
And Cindy, if I can just add to that, and probably other people have this question too, so the short answer is yes. But when we've seen in our work group here, we've seen like the initial version of the software, what it comes out with for the assessor is the client, quote, may be eligible for, and then it lists out the services. So if you had somebody with developmental disabilities, a likely outcome of the assessment would be may be eligible for Rule 185 assessment, and then as Pam says, you're still going to need the same supporting documentation as you always did. But yes, you will be using that tool for those folks, not the old tool.
The second question related to assessment, and I know we've heard this one a number of times. You mentioned the assessment would be, my screen moved. 1 second. You mentioned the assessment would be completed in the county of location. Is that synonymous with the county of residence?
Not necessarily. The county of location is where the person is at the time the assessment needs to be completed. So for example, if they are in a nursing facility or in Anoka Regional Treatment Center, and they need an assessment, that's where the person, they might live in Hennepin County or Dakota County, but if they're in those kinds of settings at the time that the assessment actually needs to be done, then it's the county where they are, but when the assessment needs to be completed.
So it's not necessarily residence, but it's the county where they physically exist at that moment.
Okay, and this is me going to have to do a little asterisk to this one. DHS people, plug your ears, but I'm just going to tell you right now, Anoka County, we want to do all of our MnCHOICES for people in AMRTC, so our own people. So I think there's going to be informal county arrangements to make some of this work a little bit better. We, as a work group, we looked at actually putting in statute or rule a whole list of exceptions for, well, but this won't be the case at Anoka, this won't be the case at St. Peter, blah, 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 and we ultimately just decided that it just needs to be handled informally by counties in the way that's going to be best for the people receiving service. Is that okay that I said that publicly, folks? They're shrugging. I guess it was okay.
I'm going to do, I'm going to scan my questions. I'm going to do one more now. And then we have a number of detailed slides that we're going to be getting into about reimbursement and staffing. So what I'd like to do is I'm going to ask you guys to chime in on this question, and then we're going to move into our next section of presentation, and I'll come back to a couple of these questions that I think dive a little deep into those details. So could you say a little bit more about the federal requirement to unbundle case management and assessment?
Well, I mean, I think what we're trying to, right now what we have is a case management system that bundles administrative activities, which are really, and we'll talk a little bit more about this in the slides, which are really considered administrative, so they're really gatekeeping functions. This assessment is really assessing eligibility for possible services and programs, and as such, for people who are on medical assistance or may need medical assistance to utilize those services. And as that, they're considered administrative functions. Right now, we kind of wrap that administrative function up with the service of case management, and service of case management is really a service. So we're really trying to split out those gatekeeping functions as administrative functions, because it's important, and Diane, you can help me with this maybe, it's important for us to understand what are we paying and reimbursing for administrative activities versus service activities.
Correct. Yes, this is Diane Robinson. Pam is exactly right. The assessment function is an administrative activity and needs to be paid as such.
All right.
Yes,
I'm going to move us on to next steps. Maybe. I'll let you help me with that. And just want to let you know, we've received maybe another dozen questions. We are keeping track of them. We'll try to get to as many as we can during this discussion. And for those that we don't, we will be putting together a written response so that every question will get answered. but we're going to move on to next steps right now and then move into some of the details that I hope will answer some of your questions.
So for DHS, the next steps are continuing to build the MnCHOICES web software application, get it ready for implementation or launch, as we like to say. We are working with our partners, with you all as our partners, to determine what that's going to look like. And our testing is very, very important. And we have just completed our beta testing, as I said earlier, and now we are looking at all the comments, all the questions that people had, and we are also looking at how the whole thing functioned. And we're bringing those in-house to make the determinations along with our MnCHOICES team to say what needs to change in the application before we go ahead and put it out for beta 3 testing, which will be the final testing. And we're hoping that what we want is that beta 3 will look exactly like what the release 1 will look like. So that is a very important piece. In addition to that, we need to implement our payment structure, and we'll be talking about that. And we are in the process of bringing up our assessor training and certification to county staff. Nancy will be talking a little bit in more detail about what that will look like. And we want to provide communication statewide. We are really trying to beef up, if you will. We're at a point where we know that you all need information. We know that you all want to know what's going to be happening. And so there's a couple of different ways we are sending out what we call a communication document on a weekly, monthly basis. Called MnCHOICES Matters. So we'll be updating where we're at, and we'll be communicating with people in that regard. We will have monthly MnCHOICES webinars that will start most likely in February. And we do have our website that has our frequently asked questions and overview information of MnCHOICES.
Okay, and I'll take the for county boards portion. Really what we need to be ready for at the local level, if we can go back, there we go, is to be ready to make decisions for local implementation of MnCHOICES. And I can see kind of the questions rolling in here. A lot of them are about budgeting and staffing. And these are exactly the types of things that counties need to be talking about and considering how you want to implement it locally. We'll give you more information here now in the next portion that you can take home and have local conversations about how you want to implement. But essentially the 3 areas are budgeting, staffing, and technology, making sure you have the number of staff available that you're really going to need to do this task. There are some technology requirements that may be new for some counties, and then obviously the budgeting issues are primary for all of us. We have said in our county for implementation of MnCHOICES, we have a new rule. Nobody gets mad in the first year because, folks, even if DHS were to do everything perfectly on their end, this is going to be bumpy. It's a totally new thing that we're going to be doing. It's a system transformation. We would be lying if we said there aren't going to be bumps in the road. So I think our job locally is to learn from the bumps in the road, to communicate with DHS about what did and didn't go well, and really, hopefully before a year or 2, but sometime within year 1, get to the point where this just turns into business as usual. But it is going to be a transition, and we do have to acknowledge there will be bumps along the way. And with that, I think we're ready to move to our second section here with more details.
All right, so I think this is what everybody is starting to really look at, is when are we going to launch this. As I told you, our dates, yes, they've moved, and we understand, but part of the reason, and I think Megan did a really nice job of explaining as well, is all the information that we're getting back from our first implementers really impacts the next phase of testing and then the launch. So we're looking at initial release in the summer, but again, I think Kay also said it well, in that everything that we learn will impact when this launch happens. So we're looking at the summer. There are also releases after the initial release, so there will be a second release that will come relatively soon after the first release, maybe within 6 months or a year, but I'm not making any promises, of course, so don't hold me to that. But I also want you to know what's really important, I think, about MnCHOICES as well is that we've designed this in a way, and we're using technology in a way that will allow us in future releases to make changes more quickly. You don't have to, the kind of technology we're using doesn't require a lot of programming. We will be able to change questions. We'll be able to change rules as they get changed at the legislature. So we really think that the technology that we're using with MnCHOICES will give us a very nice way to make changes that occur over time more quickly, and future releases to be improved as we learn more and go along. So we're actually really excited about that. So I think everybody wants to know about how we're going to get paid, right? So your voice up. Yes, I keep my voice up. Okay. As we talked about earlier, these assessments that we're talking about are administrative gatekeeping activities. And even though it's MnCHOICES, it really means, too, that the assessments that you're currently doing are really more administrative in nature than they are in case management in nature. So what you're actually doing now with all the different kinds of assessments that you're doing and they really are administrative. And that's one thing that we're really trying to pay very close attention to as we move forward with MnCHOICES. So these gatekeeping activities help us administer our Medicaid program. And then we delegate, as we've talked about, the Medicaid administrative functions then to the counties. Currently, we reimburse these assessments in 5 different funding methodologies. Sometimes they're service and sometimes they're administrative, and we really just have to get a better understanding and a better knowledge about what, and define it for you so you all know what's administrative, what is the service, and that's really where we're going here. Then reimbursing these types of assessments as service it does contradict CMS's intent to delineate that gatekeeping function from services such as case management. Or is it? No, I'm sorry. So how are we going to do this? So as I said, MnCHOICES activities are eligibility assessments, and then will be reimbursed through random moment time surveys, time studies. And the time studies is how we draw down our federal financial participation for Medicaid administrative claiming. There are 2 options for, as we talked about, administrative FFP and service FFP. And so the random moment time studies are Minnesota's approved methodology to pay for our administrative activities.
Okay, Tom Henderson from Brown County. I've been with this project for the full 3 years now, but kind of specialize in the fiscal part of it. There's 3 types of studies that MnCHOICES will use for reimbursement. One is long time with the counties. We're very familiar with it. Better known maybe as random moments. We'll call it here the SSTS, Social Service Time Study. That's for staff of the Human Services Agency. They will be studied that way. The LCTS came a number of years ago when we started collaboratives in Minnesota, and that will be used for public health. They're already a part of it for public health, but now this will be added to it. And then for the tribes, we have what's called MATS, or a Medicaid Administrative Study, which does the same thing. The random moment surveys are sent to staff to identify exactly what they're doing at a particular moment in time. Human service, social service people are very familiar with this over the years, and there's been a lot of misunderstandings about it. There's an element of secrecy that this has to have in order to be approved by the federal level, and just to make sure that everything is done properly in Minnesota. The time study codes and definitions for MnCHOICES will be separated from the rest. They will be new. So people who are doing the time study will have codes that they know belong to them. These are activities they would be doing, not other things. I will talk about that later. That's very important. The reimbursement for MnCHOICES will be the usual MA kind of thing with 50% federal, 50% state. There is no local share in that, never has been. It will cover 100% of the MnCHOICES eligible cost as determined by the time study cost and activity report. And this last thing is something that's come about as a result of counties' uneasiness about the past shroud of secrecy around this whole payment method of random moments, that we want to know, are we getting our money's worth back? So if it's costing, and counties need to track, they need to know how much are they spending for this, and then because the states agreed to do it this way, we will know after the fact, unfortunately, whether we're getting our money back or not, in that there will be a separate line item from all the rest of the things this same study pays us back for, just for MnCHOICES. This makes us all uneasy that we're going into this having to hire staff, support people, without necessarily knowing that the check's there. It will be in the mail, and we will know when we get it how much we're getting just for this function. The department has agreed to do it that way. I can't tell you any more about that at this point, but that is the plan.
And it's anticipated that we will start this payment structure July 1st of 2013. Because we're unsure about when the launch of MnCHOICES will happen, and we're talking maybe this summer, there will be a point in time. Let me just explain that in order to, you can't stagger a start of random moment changes. Is that correct?
That's correct. Yep, Pam, can I jump in?
Sure, go right ahead.
Good morning, everyone. I'm sorry about the frog in my throat. The bullet there that says it is anticipated that this payment structure will begin July 1st, 2013. What that means, and I don't want to take up too much of our other presenters' time here, what that means is that these activities will be added to the 3 time studies that Tom talked about, the SSTS, the LCTS, and MATS, beginning July 1st. The way the feds require that we bill for administration is, as Tom said, after the fact. So it would be the equivalent of doing the work, spending the money, and then after the fact submitting an expense report to the federal government and getting paid after the fact. That's how we have to bill for administration. It is not a fee for service. And going back to what Pam talked about, it is separating this activity. It means unbundling that rate, and that the MnCHOICES assessment activity will be paid through the time studies. So the first payment for that eligible activity reimbursement, you won't see that July 1st, because for those of you who are familiar with the time studies, we sample staff July, August, September. Then our federal claim is due at the end of October, and you'll see the first payment the first week of November. That's assuming that we keep this July 1st start date. And as Tom said, the payment that is attributable to the MnCHOICES activity will be detailed. So you will see the amount that was the 50% FFP and then the 50% match that I think you intend to talk about here shortly. So I just want to clarify that even though the bullet says that the payment will begin July 1st, it really, what that should say is that the collection of the activity for reimbursement will begin July 1st, and the first payment would be in early November, following the routine time study payment schedules.
I'm going to jump in. This is Julie Ring again for a minute. I know we have a lot more. I'm looking at my slides, and we have a lot more detail to cover, so I'm going to let my presenters tell me if these questions can wait or not. But I'm getting a number of questions around a similar theme, and I'm wondering if you can speak to it in a general sense. And it essentially is trying to drill down into what will be reimbursed. So I'm getting a number of questions about how will back office functions be reimbursed, or will they? So IT costs, legal costs, the things that are not direct assessment type costs. Is there a method that those types of costs are covered? And I'll have you talk just a little bit about what those are. At the same time, I got a similar question. One second. Oh my goodness, they've moved on. Let's start there because I've got a whole bunch more that came in. But could you just talk a little bit more about the scope of what's included in the payment and how that's determined?
Absolutely, Julie, because I understand this is, really good questions and important information. When we are claiming administration from the federal government, we are obligated to follow something called OMB Circular A87. It's the Office of Management and Budget. They have circulars that detail exactly what types of costs can be submitted for reimbursement. So in regards to the questions, I think they came in from the commissioner at Chisago about the IT costs and the backroom costs. All of that has to follow federal cost allocation plan regulations.
Got to be louder, Diane.
I'm sorry. I'll try to talk louder. All of those costs have to be in line with the federal cost allocation regulation. So if you're familiar with your social service time study, you know that the county social services submits a cost pool every quarter, and included in that are not only staff costs, but really all costs. And from there we have a claiming mechanism that we use to determine what the eligible costs are. So of course staff costs are eligible, and direct costs are eligible as they pertain to the staff. There are indirect costs that are eligible. This is all detailed in about a 100-page federal circular that I won't bore you with today, but it's federal cost allocation that governs the rules of what exactly we can reimburse through the time study.
Could you repeat that federal circular number?
Absolutely. It's Federal OMB Circular A87.
And is that something you can provide a web link to me? Or is
Absolutely.
So for those of you who are asking for more details about the federal circular, I will make sure that that information gets posted along with all the materials from this webinar in the same package. It is very long and detailed. I'm not sure it's the reading everybody wants to do, but for those of you who are asking, we'll make sure it's there.
And actually, this is Megan. I just want to jump in. I really appreciate Diane's technical knowledge, but I'm going to try to use my social worker translation brain to put it into English for people. As long as you follow the instructions for how you submit your cost pool to DHS for LCTS or SSTS, you should be fine. Most of your administrative costs will be covered that way. What Diane is just saying is that not every last little corner of your office may be covered. The feds might not allow it, but most all of it will be covered. So I would encourage people actually not to really pay attention to the federal circular. Just follow the instructions in your cost pool, and that is how you will get reimbursed. That's my advice. Tom, do you have different advice?
I think there's been a misnomer historically with random moments that the only money that you get back is for the moment that's tried out. So if they come in at 12:14 and this social worker's at lunch, well, that's a zero for you. That is not the case. That's not the way this works. If they're doing eligible activity, let's say comes in at 11:30, they're doing an eligible activity, well, that's going to then be a part of the pool telling the system what portion of the social worker's time is being totally spent on MnCHOICES. Then when she goes off for lunch an hour later, that time is covered by the percent of her total time to programs that was a part of the study.
Yep, I'm going to jump in and add to that, Tom. Thank you for bringing that up. This is Diane again. A random moment time study replaces 100% time reporting. So in an attempt to not have all of your staff do very time-consuming 100% time reporting, this is a very efficient way to do cost allocation, and it's completely web-based. So I guess the short answer for those of you who are concerned is what will be paid, how will it be paid? MnCHOICES assessment activity will be paid effective July 1st the way your other social service administrative costs are paid. There'll be more information to follow. I'll be sending routine updates to the county fiscal supervisors and our time study coordinators. We're going to copy the human service directors. We can certainly tell them to copy, all interested parties so that everyone has that technical information that Megan spoke of. Thanks.
So I appreciate that we're getting lots of questions in. I'm going to ask my presenters to turn back to their slides for a few minutes, and we'll continue on with the presentation, and I'll continue to sort through the questions, and we'll come back to you in just a moment.
And I also want to make sure that people know that during this changeover, you'll still be claiming, because you're claiming fee-for-service now, you're doing assessments now under fee-for-service. So how you do that, you can bill for those activities for all the way up for 12 months. So the codes that you can bill, so anything that you're doing before the time study starts, you can still bill as claiming for fee-for-service, and you'll get that money whenever you bill. So our understanding is that counties don't bill immediately for every single thing that they do, that there's some 60-day lag, if you will, in terms of approximately that, in terms of when the service is provided and when you actually bill. And so there is still money coming in from the fee-for-service claim once the time study starts. So I wanted to make, so even though the time study has to, the collection of the time to do the payment for the time study starts July 1st, if there's still ability to bill for your fee-for-service service claims that were before that, and that money will be coming in over the course of the time that you won't be billing that way anymore, or once you start the time study collection. Does that make sense? Did I explain that okay? Okay.
Near the end, you did.
And I'm going to add to that. This is Diane again. We just can't have a foot in both worlds. We have a cost allocation. Again, here we go with the technical, but we have a cost allocation plan with the federal government that says, here's how we're going to bill you for a particular activity. When we draw the line in the sand, and currently the date is July 1st, and we say, okay, all assessment activity that is involved in MnCHOICES will now be paid through the time study, how the rest of social service administrative activity is paid. That flips the switch then. We can't have some counties billing fee for service after July 1st and other counties participating in the reimbursement through the time study. It has to be all or nothing, because that's the way it works when you submit federal cost allocation plans to the federal Medicaid agency.
This is Nancy Jurgensen, and I am policy lead for MnCHOICES. Before I go on to the slides that I'm going to talk about, I just wanted to make one important point, is that with MnCHOICES, new time study codes were developed along with definitions so that lead agencies, so that county workers would be able to easily identify what they're doing as an administrative activity, and I think that's an important piece. So you may be familiar with the current time study codes, but there will be new codes added, and it's specifically to identifying what administrative activities those assessors are doing. So the next few slides I'm going to be talking about are what we call assurances for counties, and really these are what we have described as what does DHS expect from counties. These assurances or expectations were developed by DHS along with our county stakeholders who participated in our different policy meetings, and it was really to recognize the fact that lead agencies have different resources and that they need to know, the counties need to know what is expected of them, but based on the resources that you have, whether it be staff, whether it be the type of, if it's a certain type of population, if you're rural, if you're in the metro area, you need to be able to have the opportunity to develop your own processes to meet that expectation. So the first assurance or expectation is that counties are to perform administrative functions and activities. And we've talked about that in the previous slides. We're talking about the functions of assessment and support planning. MnCHOICES will support that in developing, determining the level of care determination and eligibility for programs and services. Along with those administrative functions of assessment and support planning, there is an authorization process that needs to take place so providers can be paid, and then a quality management piece as well, which has been referred to, such as some of the reports that will be used to analyze data that's coming in. The second expectation or assurance is to provide access to assessment processes. And that is really no different than it is today. That basically means that when a person calls in and requests to have an assessment, that the county provide an assessment. And it doesn't matter if the person is on medical assistance, it doesn't matter if the person called themselves or somebody else called, but that people are given access to the assessment. And along with that assessment is that they're also being provided information about other resources and information in the community if they choose not to have an assessment, but rather just want to know what are some other community resources that could help meet their needs.
Nancy, before we move on, I just want to jump in on a very specific question I think you answered. On the assessment process, we had a question about, can counties charge a fee for this assessment? I think the answer is no.
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 But I want to be clear because we got the question.
No.
Yeah, I want to be clear in understanding what the question is, but no.
And also, can you just say a little bit more before we move on about why the assessment is happening by current location and not by county of case management or residence? It's my understanding that that was a statutory change, correct? And that's why it has to be done that way. A state statute was changed last year. But I'm looking to my DHS partners to confirm that that is the case.
Well, for long-term care consultation and for PCA services already, there has been a statute that's always been that the assessment's done where the person is located. So that is a given. It's really been around the DD assessments that's more around the county of financial responsibility, and some of those, and some counties have taken that across to the under 65 CADI and TBI and CAC waivers. So while it's a change, it really has always been for long-term care consultation at any rate. So the change really is for DD, but not for PCA or for long-term care consultation.
Okay,
it's always been that way.
Let's continue on. I just wanted to catch those while we were on that slide.
The third expectation, and this is a biggie and certainly has a lot of questions that counties have, is MnCHOICES. The counties need to ensure that there's an adequate number of certified assessors to complete the assessment. And this is based on the fact that only certified assessors can complete assessments as well as reassessments, because reassessments are considered redetermining eligibility for programs and services. So what I have included are the qualifications and experience of staff who can be considered for to be a certified assessor. The net was cast very broad because the intent was not to exclude current staff or current case managers. And so as you read what those qualifications and experience are, again, it's really up to the lead agency management to make that determination as to whether this applicant or whether this staff person meets those qualifications. of having that community-based experience and also the education requirements as well. Along with that, I have a continued slide, if you want to change slides.
Yep, sorry, it's coming. There you go.
Okay. So I saw a question coming through, and the first bullet is really like, what are some ways that counties are going to have an adequate number of certified assessors? So I included this bullet just as some ideas. You might reassign some current county case managers, or in some or many cases you may have to hire new staff in order to meet that staffing need. And then I really wanted to focus on the point that there is a very important and strong role for that case manager in working with that certified assessor, and that there definitely will be a handoff then from that certified assessor after they do the assessment, develop that initial community support plan, and then hand it off to the case manager if they're going on a waiver or alternative care program. If there's a case manager that's identified as a service, and that case manager will then work with that individual there and what their goals and preferences and needs are, and develop that actual service plan that will then be put into MMIS to get paid and to have the providers paid. The final bullet really talks about once staff are identified as potential certified assessors, there's a requirement that needs to be met to receive MnCHOICES certification and training, and we call it MnCAT. Of course, we need to have many acronyms. You can change the slide. I included this slide as a visual so that you could see that there are 3 steps to attaining certification as a certified assessor. When you get the handout, you will find on a following slide there actually is more of a detailed description of what each of these steps are. I'm not going to go into any great detail, but it does require testing out, and then that final step 4 meets the requirement that every 3 years the certified assessor needs to be recertified, and there are plans as to how can that certification be met. And one example might be attending workshops or trainings that help support their role and to increase their skill and knowledge with the type of assessments that they're doing.
Next one.
Number 4, that's the slide that I was referring to. Then counties also need to develop a certified assessor multidisciplinary team. Again, this team would be comprised of the social workers and public health nurses and other professionals who are doing those assessments. There is importance in identifying who is on that multidisciplinary team, who are certified assessors, that they have a broad experience and expertise for all ages and disabilities, and that this team is an opportunity to support each other in assuring that understanding of programs and that developing support plans are done specific to the desires and the needs of that individual. I want to also add that part of this certified assessor multidisciplinary team is that there is an expectation that there are supervisors, certainly supporting staff in this role. We have developed in the MnCHOICES Administrators Toolbox group, and the role and purpose of this group is to identify what are some tools that supervisors and managers need to support their staff in practicing the training that they have received and continuing to have feedback with how to improve or enhance the MnCHOICES assessment and process.
Before we move to the next slide, Nancy, I want to ask you 2 questions that have come in specifically around the staffing piece, because I know we're going to move to a next step. So one that I'd like you to clarify a little bit is, has it been determined that an assessor cannot also be the case manager? Or can one person do both functions if there's a clear delineation of responsibility? Is the answer to this question different if we're doing the assessment as a county mandated function or on behalf of a managed care organization.
A decision was made that there are different ways that counties can decide to meet the expectations of having an adequate number of certified assessors. And so the same staff person can be the certified assessor and the case manager at the same time. Or counties, and I know some have developed this, they have separate assessment teams and then ongoing case management. So in answer to your question, yes, there are different options available, and it is true for managed care organizations as well, that the care coordinator can be the certified assessor and the care coordinator or case manager at the same time. For over 65, it's my understanding with the managed care organizations, that's actually their preference.
And if you are serving or contracting with a managed care organization to provide these assessments, then you will act as a managed care under the managed care rules and not as a county person.
This is Megan. I just want to jump in real quick here too. I know in very small counties, unless you gather together with other counties to accomplish this task, it's going to be difficult to split out these functions because you don't have enough staff to have a team of one and a team of another. I can say from a large county perspective, we are splitting out the roles. We are having a team of certified assessors and case management separate. One of the reasons we're doing that is we don't think we can carry out the quality assurance functions of it very well. One of the things the assessor is going to be looking at is the person's satisfaction with case management, and I think it's awfully difficult for the case manager, to get a very accurate assessment of how happy the person is with the case management when the case manager is asking the question. So I think there's that piece. Also, what our beta testers have told us, we're a first implementer county, is it's complicated to become a certified assessor and to learn this new assessment tool. And some of our staff who originally wanted to keep this function now are saying we want it to be separate because it's just too much to learn in addition to all the things we have to know to be case managers. So I'll just throw that out there as some thoughts about implementation. Let me ask 2 more questions before we move on. Megan kind of opened up the door to a general question I received in a few different ways early on, and that is for small counties, will it be allowable for small counties to potentially come together and do this work across county boundaries in one way or another? And I'm getting nods around the room, yes. So I think the easy answer to that is yes.
Yeah, I mean, and I think in the current 256B.0911, I'm sorry, I shouldn't be a bureaucrat and name those kind of statutes, but in the current statute that gives us the authority, or to do this assessment. We do encourage and say yes. We encourage counties if they need to come together and do these assessments, do this activity together.
Another similar, maybe related question I've received is for some counties that are concerned that their current staffing might not meet the requirements that are laid out here, will there be a phase-in or waiver process for counties who simply can't find certified assessors or who are unable to draw in employees and then put them through the process? How will those counties function?
I think we need to do is really start meeting, is to come and have those counties talk with us and really start meeting with them to come up with some solutions for them. I mean, it could be working with, again, getting together with other counties in their area and see if they can't draw somebody from there, or but we do need to work with them to help them figure out how they can manage that.
I think that that's a particular concern for some of the ring counties around the metro, where their staff are being drawn into the metro for higher salaries, and so they're training folks and then losing them quickly. So I do think that's an issue. Pam, could you actually repeat the statute site that you rattled off? Someone's interested.
I didn't think anybody would want that. 256B.0911.
And actually, this is Megan. I have to jump in on the staffing issue. I don't think the requirements for certified assessors are really that different from merit system requirements for social workers.
the certified part of it is that you go through this training program that DHS offers. So I guess, you know, we have our own merit system. We don't do the state merit system, but I'm not thinking it's going to be a huge problem for Greater Minnesota. I guess if it is in pockets, you know, we'll have to problem solve that, or DHS will have to problem solve it. I just don't foresee it as a problem.
The 1 year of experience is probably the biggest problem.
1 year of experience?
Yeah, or 2 years if it's an RN. And I think because the concern we have is that, particularly with nurses, they get into a job somewhere to get that year of experience, and then the counties are supposed to attract them back away from that job to do this job. I can understand why they need experience out in the field before they start doing this assessing. The difficulty is going to be trying to get them back to the county.
One more question, and then we're going to continue on, because a number of questions that are coming in I think we'll get to in another section. But I did have a specific question. Will a supervisor of a certified assessor need to go through the training and be a certified assessor?
A supervisor of a certified assessor is not required to be a certified assessor unless they will be doing assessments. That's the requirement. So if a supervisor does assessments, yes, they need to be a certified assessor. If they are not, then they do not. But they might find it very helpful and interesting to take the training to be able to understand what their staff are required to do.
It'd be highly advised.
It'd be highly advised and best practice, but not required.
I sure would want to be a certified assessor if my unit was doing MnCHOICES. This is just Megan from past experience as a unit supervisor. I think it would be difficult to supervise effectively without doing it, but I'm glad it's not a requirement, but I can't imagine not doing it.
Well, in the interest of time, I'm going to move us on to talking about, whoops, let me get my slides moving here, technology, and I'll continue to scan these questions and see if we can come back to them at the end.
The expectation, as you can see on this slide, is to provide resources for technology. So there's different bullets regarding that. The first is to understand that the MnCHOICES assessment is a web-based application that can only be completed on a laptop. So certified assessors will need to have laptops, and you can see with the bullets under that there is an SSIS update handout that Julie will be posting. You'll be able to see those requirements. It gives the minimum technology requirements. What we have heard from beta testers is don't settle for the minimum, because the minimum may not get you what you really need. So those are minimum requirements, but there'd be strong recommendation to go higher than that. The other part is that certified assessors need to have an internet access, and that has to do with when you're in the office to be able to go back online and work with the different systems. SSIS requires that. With staff, it is important that they have some computer proficiency, which is a responsibility of the county. It's not an expectation of MnCHOICES that we would be doing basic computer instruction. What we have most certainly found and heard from beta testers, and we will be working on this, is that many counties' staff do not use computers or laptops out in the community. And that is, I think, an initial barrier to, and it creates a fear almost of MnCHOICES, because they're not familiar even with using those laptops. How am I going to use it? How do I keep eye contact? And so that's something that we've heard from beta testers. And through the toolbox, we'll be developing some tools for supervisors and managers so they can work with staff to get over that initial issue. And then the technical support for staff, that just means what we've also learned with beta is when there were problems, it was not always at the end of DHS's assessment, but sometimes it was the technology within that county, that they had certain programs running that really didn't intersect successfully with MnCHOICES. So to have a technical support person who can work along with DHS or to work with staff is a really important piece as well. And then the final expectation is to conduct quality assurance and monitoring activities. As Megan had said, within MnCHOICES there is quality questions about the case manager that the assessor will ask. That's part of MnCHOICES, that's part of getting that feedback. And then also the expectation is for the lead agencies or counties, to use that data and reports to help with their program management and ongoing for home community-based services. Thank you.
So before we turn this over to Kay and to Tom, I just would like to say that a transformational change like this really requires a real dedicated team effort, and DHS really appreciates the partnership we've had over the past 3 years with the counties and really preparing for this. You played a critical role in providing input into the training, the policy, the content of MnCHOICES, and testing the software. I talked about the first implementers and how much they've identified for us. And I just want to say that it's going to be important that our partnership continues not just before the launch, but after the launch and ongoingly.
So now we're going to spend a few minutes hearing from two of our local county folks. Kay Dickinson from Dakota County was one of the pilot test counties, and Tom Henderson from Brown County has been a member of our work group for, well, since it started a couple of years ago. And so we're going to let them run through some lessons learned from their perspective, and then we will circle back to some questions as we have time.
Again, this is Kay Dickinson, and Tom will be following me. We really feel that we're very excited to hear what the rest of the beta testers are reporting back, and I think that information will be coming out in the next week or two for some of the stakeholder groups. But again, a collective effort. I think 16 or 17 entities have been partnering with the state and giving reams of information back. And I guess if I can begin and end with that we feel like the comments have been received by the state, and we trust that the state will continue to hear our important feedback. And we can see by the number of questions and the scope of questions that there's a lot of tentativeness out there. But the variety of us who have touched it and felt it do feel that there's a way for us to make this accomplish the goals. So with that, I go to the next slide, Julie. We really feel that the certified assessment training really was critical and helpful to the development of our case management staff. Again, what you have, just like we talked about the different assessment forms, you really create these specialists who think just in those categories in their everyday way. So our PCA assessors, who are wonderful, and our seniors who work with all of our over 65, and our DD staff and our folks who work with our hospital level care kids, they all have these unique specialties. But it's been really helpful as people took the time to go through the training in an optimistic way to say, boy, I didn't know that with DD this is how this worked, or I didn't know with CAC. You know, so it's really broadening the horizons of everyone who's going to meet and greet those clients to really say, boy, there are a variety of resources, and I am here to commit to helping you with this. So again, from a best practice and really a boost to our case managers to really say, boy, I still was working in kind of a silo. This was really an aha moment, so we were excited about that. The staff also felt that this was a navigation-friendly tool. Again, we had the same trepidation as others, as we're seeing with the comments about how this is going to really flow while we're with, I always use Martha as my client. When we're with Martha, how will that really work? And we really feel optimistic that it's pretty slick. And yes, it is new, and it's taking time for us to get used to how this pattern and how we'll engage with the families that we're seeing. But again, I'd say that the staff, the 7 staff who did it in our county, have really given hope for all the rest of us to say it's very feasible and it will improve our practice. The third point was that it yielded additional helpful information. When we used the MnCHOICE tool, we did it on folks that we currently knew. And really about 90% of the time, the MnCHOICE assessment tool did come out with some pertinent, helpful information that affected how we would really either scale down or scale up the kinds of support we had. And again, that we felt that the eligibility rules were effective. So again, we had staff going in saying, well, I think this person will be eligible for a CADI or a brain injury waiver. And yes, it came out with that same result. We also trust with the level of care changes coming up in the next year, in 2014, that what Pam's comment to say that behind the scenes or the Wizard of Oz curtain, this is really going to be something that is nimble enough that the rules can be changed in this tool and come out with a recommendation that's relative to the program rules of the statute at the time. So yes, Pollyanna, well, we think that it really has potential to really improve our practice. Are there gulps and hiccups and wonderments about, boy, how will this work for all of the individuals that I have on my staff? Yeah, we know that there are different types of learners, and we're going to have to be kind to one another and supportive and try to see how we can work through it. So the next slide, in terms of where, again, Dakota County, and I think some of our peer counties who are going through this, and I saw one of the questions was, is there a formula of how I set this up if we want to do what Megan's planning to do of having separate assessors? Well, how many assessors are you going to need, Megan? How many assessors are we going to need in Dakota? What are we going to need in Blue Earth? All of those are tough questions because we haven't gone through the beta 3. And all I can say is I also trust that as the clock starts, we're going to continue to partner with the state to figure out, is there a way for us to manage like the numbers of clients, even though we're going to have to turn the key on how we bill, but that doesn't mean all the PCA assessments have to become MnCHOICE day one. I understand that the state's hearing our feedback that we're going to need to work with this in somewhat of baby steps to really make sure we know how to set up the rest of our teams. So at Dakota County, we are really going to have an initial certified assessor team, and we are currently making plans of how we can expand that team as we go forward. Also, some other things we're thinking about. One, intake. I know that there are out there a lot of folks who, like us, have different points where clients come into our system. You may have a public health intake. Social service may have a variety of intakes for mental health, kids' mental health, adult mental health. And again, these clients are going to be the same clients. So it's still an opportunity for us at Dakota of how we're going to try to bring in our DD intake into our what we call our public health or community living intake. So again, every county's got an opportunity to say, how do we get the calls to the right place? Because the tool will start with Martha or her kids calling in saying, I need some help. So we're wanting to set ourselves up that we don't have to pass Martha or her family around a lot. So again, that's an implementation consideration. We are just saying, we hope you're taking some of this to heart to say, boy, are there ways we could do this different? Workflow and these types of transitions, it's not all baked yet in my head or I think in Megan's head, totally how this workflow is going to work for us. It may have some different nuances. If we have, we know we have clients that aren't on MA the minute they come to our intake. So how do we handle that when someone doesn't get on economic assistance MA for 90 days? You know, who's going to hang on to that client? Those are things we're going to have to work through. how are we going to handle clients who may be eligible for a CADI waiver, but there's a waiting list? We don't have a ready answer for that, but I trust together our commitment will be that we're going to figure this out. How about with seniors? We know they start at the county. They'll get a MnCHOICE assessment, so that may be Jane who goes to see Martha. And then will it make sense in this situation? And at Dakota County, we're kind of thinking that way. Since so many of our folks eventually switch to a health plan, maybe Jane, we may choose, continues to be the ongoing short-term case manager until that person chooses health partners and then gets a new person. So again, from a continuity of persons, how many people do these seniors need to get to? I mean, I think we'll flex the process but still commit to the assurances. And I guess I would just end with, we have found that our staff are still, even with the complicated and the newness, they're interested, and we just did a survey. We don't have the results back yet, but over half of our staff are very interested in being trained, and even if they want to do ongoing case management work, they're saying we want to be certified or trained to understand the process. So that was a aha for me, that we're probably going to want to eventually have everyone be exposed and trained. So with that, Tom, take it away for your perspectives.
Much smaller county than Dakota. We could fit Brown into a tiny corner of Dakota someplace.
You're going to have to speak up, Tom.
Okay. We do need, though, no matter what the size of the county, wouldn't really matter from the standpoint that this assessment process absolutely demands a teaming of nursing and social services. Some counties are quite used to that. We've got actually a majority of the county with combined agencies where they're used to working together. And that varies from A to Z in terms of how much historically that's happened. In the future with this assessment process, I can't see it working well at all unless you've got those two professions working hand in hand every day. Because in the past we've had a lot of assessments that with the separate kind of process we did that demanded one profession or the other more so. In the future, because of the assessments being done on all kinds of folks, disabled, elderly, and having one team to do it, that team has to have both that public health nursing ability in it and a solid social work ability in it. And they need to work closely together every day. That is crucial. So it can't be two teams. It needs to be one team. So I can't emphasize that enough. Then in terms of separating the case management and the assessment function, that is our future. We need to think about that seriously now. This is a time when we're forming the units and the staff and the ability to do this well into the future. It has taken us 3 years to get to where we are. I really don't think this is going to go away soon. I think this could be something that could be here 10 or 20 years from now. And the decisions made in counties in the next months here as to how you're going to form and put together the ability in your county to do these well could well carry over for generations into the future. So it's very important to do it right at this point in time. Getting teams together with the right training, the right background, the right abilities, the right working circumstances that they're in each day. We feel like they need to be under one direction, and the state's already helped us with that a few months ago. They asked every county to name one person who's going to be the charge person in that county. So you already all know who that person is, and that's going to be a person communicated to from the state as a key kind of person in that county responsible for putting the teams together and making this whole thing work. I think in many cases it's an adult services supervisor. but it depends upon how your county is organized. Having this team separate from case manager, separate from other parts of the agency, it can't be too far away, not in a smaller county at least, because they hand off. I have this analogy in my mind, and it's not a part of the program today, but I'm always doing analogies, and I've got this thought in mind of kind of a cliff, not a dangerous cliff. The ground is not too far down below. But the social workers and nurses are along the edge of this cliff. People are coming at us from behind, and those folks are more and more needy of services in order to stay on this plateau and or land softly into a service kind of a continuum. So I think historically, because we haven't done a lot of assessment, haven't had the money to do a lot of assessment, and we're just an anxious bunch of people that want to get services to people as soon as we possibly can, we've tended to take a person and say, oh, let's jump off here. This looks like a good pillow below for you to land on. And I think we've been a little bit too quick, always have been, to help people off and into the service. What this new system is going to do is make us spend a whole lot more time on the edge and saying, where are you coming from, what are your needs, and what is all down below here that may or may not help you. Where should you be, quote, pushed off to get services? For me, this helps me understand kind of where we've been coming from and where we're going, because we're going to spend a lot more time on that edge, making sure that people go to the right place and not just jump and hope things work out. Because we all know it's mighty hard to get back up on the cliff again once you've jumped into a particular service continuum of care. The pros and cons of having teams separate from other staff, I think I've talked about now. Cross-training in small counties, you can't get along with one or two assessors if that's your workload. And the state has put out what they anticipate your workload to be for assessments in a year, and that should give you an idea of what you need for staffing, or at least the beginning of a plan for that. But if you need to work with other counties to be sure that that assessment function is backed up, the thing about this is going to be that when people come to you, it's going to be needed right away. You're not going to be able to say, wait. And I think we know that people come to us in crisis from time to time, and we don't have a lot of time to act and move. So, and then the whole idea at this point in time of contracting case management, if there's ever a time that starts thinking seriously about that, this is the time, because it may really help you with how you do your staffing. Also, if for a long time you've thought about home care and privatizing the whole element of that, how to separate the county from that, this is a great time to be thinking about that, because again, you're going to need to shake up staff, and that this may give you some other opportunities to do things that you've thought about for a long time.
And again, our whole goal is to really reinforce the assessment process for getting people to get into the long-term services and supports, or home and community-based services as the prior name. I think just, this is Kay again, one other comment. I know people still are asking, well, yes, Tom referred to that we know how many assessments we'll be responsible to do. Say for Dakota, I think we have 7,000 assessments. Again, since we don't have a formula, I mean, one way I'm looking at it, and we've all kind of picked different numbers, we still hope at the end of the time that still when Martha comes in and she's met at her door, she's assessed, and then there's a plan put in place and she's put on to some kind of supports, either MA supports or waiver supports. Hopefully we'll strive together that the net time for having 2 people in that scenario isn't a lot longer than it is now. You know, I mean, that we're not expecting that over time this should have tripled the amount of time from meet and greet to getting services. I think there's a fear out there that that's what this will do. That is, even though Tom said it's, but we're going to admire the assessment a little longer before we jump, it's not like this is going to be a whole nother department for you. And we will work with the state to kind of shore that up and get more clarity, because clients do need those services sooner versus later. And so when I'm looking at a staff plan, I may be initiating thinking, well, I bet someone can meet and greet and do this initial plan. Maybe they can do 20 to 25 a month. Well, we don't know yet if that's accurate or, you know, how that's going to be. And then when you roll in reassessments. But those are things that we're all going to work together and share information back with the state and try to make this as efficient and respectful as possible. So it's not a formula yet, but I think within the first 6 months, we will get to one.
So I'm going to jump in. This is Julie now, and ask a number of questions that have come up in the last bit. First of all, I've had a couple of questions from folks asking about how long the assessments are taking to complete based on the pilot test counties.
Well, based on the pilot test counties, we have heard anywhere from 60 minutes to up to 330 minutes. What is that? 5 hours, whatever. I'm not a good mathematician, but I think we need to really put that in the context of what's happening. And what's happening is you have assessors going out and using a brand new software application that isn't 100% the way we want it yet. And so I think it's going to take a little longer, and even in the first year, as people get used to the navigation of it, it might take a little longer. But we do not have an absolute time that this is what it's going to take. I mean, I think that it's going to vary between assessor, how quickly they learn to navigate the system, the application, and once everybody is actually had a MnCHOICES assessment once, and you go out and do a reassessment, you will be able to. It'll be quicker. Not only will you understand the navigation, but you will have all the information that this person had talked about the year before on the right at your fingertips. So it'll be right there, and trying to figure out. You'll know what to ask in terms of what has changed and those kinds of things. So we're not expecting this reassessment to take as long as an initial assessment.
And Pam, that was face-to-face time you're talking about, right?
That was face-to-face time, yes.
So this is Megan from Ramsey County. I just was going to add that I believe in talking with Kathy Griffin at DHS, at some point there's going to be a worksheet that comes out that helps counties calculate what their staffing needs might be on MnCHOICES. I believe that's in the works. We shared some of the work that we did, and I think Hennepin did the same. I can tell you, just as a ballpark estimate, we are planning in Ramsey County that one FTE could do 12 or 13 assessments a month. So if that gives people just an early sense before they get the worksheet, kind of what we're looking at for our minimum kind of productivity requirements for someone who's doing assessment full time. But there'll be more information, I think, coming out from that. Or otherwise, you know, people are welcome to call me in Ramsey County, and I can talk you through some of the calculations we did. But I do want to underline what Pam said a minute ago, that how we do this now and how long it takes now will not be the same a year from now. So I think we have used the computations that I talked about, and then we've sort of under-hired based on that, knowing that this is going to get easier as time goes along.
A couple more questions related to training. Can someone share a little more detail about how long the training is anticipated to take, and how often it will be offered, and if it will be available online? Folks are trying to get a sense of how long of a time commitment the training is, as well as when they hire someone new, how often will they be able to get them through the training and up to speed?
This is Nancy. I'd be happy to answer that question or those questions. when you are able to print out the PowerPoint, you will see on slide 25 that under each description of what step 1, 2, and 3 of training are, that there is an estimated time that was included on that PowerPoint slide. So when I add up all those hours from the estimated times, it will take the certified assessor anywhere from about 20 to 28 hours to complete the training. And so that's, if you're looking at it in days, that's about 2.5 to 3.5 days. I don't know what other kinds of training that your staff may go to, but when you put it in the perspective of the certificate, they're actually being certified, that that puts it into maybe a perspective that does not seem like that's overly a high requirement for time to get that certification. Also, steps 1 and 2 for the training are online, so it will be available as staff are hired or whenever they have time to do the training. And step 3, that's really the application training, how to navigate within the MnCHOICES assessment and then applying the policies and understanding how the rules run within MnCHOICES. That is being looked at as possibly having some of that be face-to-face, but we really need to look at the launch strategy that's going to be used and the amount of resources that DHS has to be able to go out statewide and do that face-to-face training. So that's still in development, and we certainly will, hear the feedback from the beta testers and have identified different areas of the training that need to be addressed to improve its efficiency and effectiveness.
I'm going to ask for a relatively brief answer to the next question. I'm going back a little ways to earlier in our questions, and not sure if we covered this clearly or not, but there was a question about whether or not counties can contract for assessors. We did discuss that counties could potentially work together in groups of counties to accomplish this work, but can counties use something other than county employees to do this work?
No.
No.
Okay, the quick answer is no.
Because they can't participate in the time study.
Right, because of the reimbursement. So if you wanted to do that, you wouldn't have a mechanism to necessarily pay them to do it. So it's it would be up to the county if they wanted to contract and not be able to have those folks in the random enrollment. But those particular contract costs are not included in a cost pool.
I did also get a couple questions along the way from public health departments that are organized in a way that they don't currently participate in the tool that will be used for their random moments. Is DHS working on a solution for how those public health nurses will be able to have their time counted?
Yes, we are, and all public health agencies will be allowed to participate in the MnCHOICES reimbursement, whether they have a collaborative or not.
Okay. And I'm going to jump back to training for a minute. We've had some questions about which pieces of the training are currently available. I'm not sure if you mentioned that, Nancy.
We had the step 1 foundation training available. However, based on the beta 2 feedback that we got on the training, while it's still available, we are working on making that more a little bit better for counties out there. We have had a lot of feedback on that foundations training, and so we really do want to pull it back and make some changes to it. But it's currently available online.
There were also a couple questions. We've referred to a number of documents throughout the presentation, and we will make sure that we provide references to those when we get these materials posted on our website. Based on the amount of work we're going to have to do, I anticipate that's not going to happen until next week, but we will do it as quickly as we can. But we did have one specific question asking if we could remind people what document provided them with information about their anticipated assessments. Several of you referenced DHS sent out a document with potential assessments. Can you remind folks where that was or how they can find that again?
There was the volume assessment data report that we sent, and I think we've sent it more than once. We updated it twice. we've sent it twice. We updated it just towards the end of this last year, 2012.
And with that, we are
But
coming.
Excuse me, if they don't have it, if you want to let us know, we can send it to you again.
And so I will make sure that folks have contact information for all these speakers when we post this on our website. But it sounds like for those of you who are social services folks and know Pam and Nancy, you can feel free to maybe send someone an email and ask for that. Because the webinar ends promptly at 12 o'clock and we are getting close to that, I just want to take a moment to ask our presenters here if they have any final comments before we wrap up, and just remind folks we got just a ton of questions, which is great, but we certainly were not able to get through all of them today, so we will be working behind the scenes here to write up some answers to these so that you can access that when we post it online. But in closing, I'd like to ask if anyone has any final comments to make or thoughts for the group.
I would just say that I think the relationship between the state and the counties on this project has been excellent from the get-go. It's a huge change for us, and it's got to make everybody a little nervous, so we all need to relax and take this a day and a month at a time. Over time, it's probably going to be a year at a time. I also see the relationship between social service and the counties changing a little with this assessment to be more like it's been with financial workers historically, in that the county hires the people, supervises them, but the state provides a lot of direction, training, and a lot of policy that's every day in these employees' lives. That is more what we've been used to as financial worker kind of relationship, not with social service. I see that changing with this assessment function.
This is Megan Mose. My final thoughts are just, I think at the county level, it's really easy to get wrapped up in all the operational details, and there's going to be a lot that we have to pay attention to implement this. But I know what we're struggling with in Ramsey County is trying to implement it in a way that upholds the philosophical reasons why we're doing this, and so keeping in touch with that, as we're working out the operational issues is what we're going to be focusing on in the next year.
And this is Kay Dickinson. I think what Tom and Megan also were saying is that, it's been a tough pill for some of us to follow in terms of boy, do we really give up case management, or what level of depth do we do that? Because in our county, we're really committed to seeing if there are other ways of accomplishing this important core county role, but also partnering with contracted case management and community agencies in a different way. Those are big switches, and we have to just honor that that's going to take some emotional energy and willpower to also get through, and to welcome our community partners out there to do some of this other important work, and that will still be there in an assessment, reassessment, and a key way to support them. Secondly, I would say is, we're also going to have to see, can we as counties do everything that we currently love to do? So I know that for us at Dakota, we've really appreciated being able to do a lot of partnering with health plans, and we see that as a core significant role, but we see that we may have to shift our emphasis on this. Again, I think it's all doable, and keep talking to all of us that are on the committees.
So final thought, several folks have asked where can they find this. It will be posted on the Association of Minnesota Counties website, and we will have a link right from the front page of our website. We will send a notice out to our full mailing list as soon as it's available. I don't think it will be available until next week. We have a little work to do. I don't know if there's a logical place that it would also be posted at DHS.
We can post it on our MnCHOICES website.
So it will also be on the DHS MnCHOICES website, so you can look to those two resources in the future. We really appreciate everyone's participation. We are out of time for today, but we will answer all of the questions as quickly as we can. And if this was useful and you would like us to do this again in the future, please do let me know, Julie Ring at the Association of Minnesota Counties. Thank you.